Thank you for joining us today for the first ever AWS Healthcare Accelerator in the UK Demo Day. My name is Kira Levy and I'm the Head of Healthcare for UK Public Sector. I'm thrilled to be here today to kick off the demo, and I want to extend a special thank you to all our partners, customers, speakers, mentors, and of course, public for helping to pull this program together. Out of 117 applicants from 13 countries, 12 startups were selected to participate in the program. Today, you're going to get the opportunity to hear from them, ranging from early detection of cancer to mental health solutions. We have an amazing and diverse cohort. In fact, half of this cohort identifies as woman-owned or minority-owned. The NHS itself has several programs that support healthcare startups and clinical entrepreneurs to achieve product market fit and grow. We're happy to say that we're further building on that success. In fact, 8 of the 12 on our program also participated in NHS programs, and we're delighted to be supporting 6 of those to internationalize their success. Here at AWS, we have a strong focus on healthcare and expanding our teams and services across geographies driven by the needs of our healthcare customers. Over the last 2 years in particular, particularly in response to COVID, we have seen healthcare organizations rely on technology and cloud to get accurate, trusted information to support their patients and direct them to the most appropriate resources and care at scale. As we move forward, healthcare must now look to access the right patient data, paired with advanced analytics and machine learning to enhance medical and scientific insights tied to patient outcomes in an accurate, scalable, secure, safe, and timely manner. And that's exactly why we invest in these types of programs. At AWS, we have always believed in startups as the drivers of innovation, and their role in healthcare is no different. We are excited to see you all today. We're excited for you to see what we have today. And as we say at Amazon, work hard, have fun, and make history.
Hello, my name is Greg Pepis, and I work on the worldwide public sector venture capital and startup team. I'd like to welcome you to the AWS Healthcare Accelerator. It's my pleasure to introduce you to Pep Health and its founder, CEO Dr. Mark Lomax. Pep Health is changing the way healthcare systems and medical providers interact with customer information. Its products use artificial intelligence and machine learning to process critical information that customers provide from web inputs, social media, forms, and other electronic inputs in order to provide feedback to healthcare providers. There is a wealth of healthcare information locked inside online customer and patient feedback. And as you will see, Pep Health's machine learning solutions unlock that information, providing valuable insights and information to healthcare systems and medical providers. Enjoy the show.
Hello, my name is Dr. Mark Lomax. I'm the CEO of Pep Health. We're passionate about patient experience at Pep Health, and our focus is on improving patient experience to improve outcomes and safety and the overall experience for patients across whole healthcare systems. We're here because the problem of listening to patients has been one that has gone on for far too long. We know that surveys have taken place, but over decades, different inquiries from the mid-staff scandals, as an example, have called for a better way of listening to patients. But unfortunately, we have not been able to find a better way until now. We listen to all patients, regardless of their background, regardless of where they post their comments, and we bring this all together in an easy-to-use fashion. This is our solution. It's easy to implement. It's easy to navigate, and it's easy for people to understand what's working and what isn't working within their health systems or their hospitals. We collect databases of millions of patients' comments, and with those, we specifically aim to improve experience, improve outcomes, and unlock value-based healthcare for systems. This is how it works. There are 4 key steps that we do, and this is built on an AWS platform that really enables us to be flexible, dynamic, and fast in what we do. First of all, we map the landscape, the picture of the locations, the drugs, the diseases that patients have. On top of that, we overlay all the patient comments that we collect, social media, online review sites, chat forums, and we tag and link those all to the locations and the diseases that we have. And then we score. We score it overall sentiment and we tag it to departments. But also importantly, what we do that's unique is we theme it into 9 internationally recognised quality domains. Things like speed of access, clear communication, emotional support, effective treatment. So we really understand what's happening from the patient point of view. And all these insights we put into a real-time dashboard that users, organisations or insurers, for instance, can use to really understand the variation and what is happening in real time across their services. We know it works. This is the only empirically proven service, and it's highly accurate and built upon a large training data set built by healthcare professionals and NLP experts. We collect millions of comments, started in the UK and collecting comments about every single UK hospital, but also now starting to collect US data sets as well. For those hospitals that use us, we know there's a 35% improvement in patient experience scores, and that's on top of reduced complaints, improved outcomes, and being able to spot safety issues faster in the organisations that look at this. We won a variety of awards that you can see on the right-hand side there, which we're delighted that this data is starting now to be validated and recognised, and now looking forward to scaling up our technology on a much broader level. This is a snapshot of our technology and the dashboard. On the left-hand side, you see a snapshot at 30,000 feet, which board members or executives might find very helpful to understand at a snapshot what's going on. On the right-hand side is a more detailed, granular page of the dashboard, which really enables wards or departments to drill down deeply and understand what they can do better, and also sharing good practice that will be happening within their area of control as well. This is a bit of an overview of our data and to show the power of it. This is the overall patient experience in England for all hospitals for the last 2 years. You can see the effects of COVID with tracking up and down, and you can just see how dynamic it's been over the last 2 years. But also importantly, you can see how the variation in healthcare has really increased over the last 2 years, and that it leaves us today in a position where the variation has never been greater across healthcare systems. Here's one of those hospitals that sits in that data. Is this your hospital? What if it was and you didn't realise it was your hospital? This hospital was performing well above the national average until about summertime 21, when it suddenly dramatically fell and has struggled ever since. CQC prediction for us would be an inadequate rating for this hospital were it to have an inspection at this time. And these types of insights we can peel back the layers to really understand why and when things are happening and going wrong inside a hospital like this. Thank you very much for listening to the presentation today. I hope it's given you an insight and a snapshot in terms of the power of the patient experience platform. We're delighted to be working with AWS and really look forward to continuing to work with them on our journey to really empower the patient voice and bring that to life. Thank you very much.
Hey there, I'm Shabs Logat and I'm a member of the NHS account management team here at AWS. And I'm here to introduce Infinity Health. What has excited me during my several weeks of getting to know this company is how they are bringing empowerment to the front line of healthcare operations. The last 2 years have been challenging on NHS staff, and the coming years is going to be just as challenging, especially as they deal with waiting times and try to restore services. What COVID-19 has highlighted is inequalities in outcomes, in experience, and in access. This will further exacerbate because of the elective backlog. Health systems who want to improve health equity will need to be bold and ambitious, especially through adopting efficient processes in frontline healthcare delivery. This is where Infinity Health can help. Where their technology is deployed, it saves staff hours and empowers frontline staff, meaning more time is spent in care delivery and seeing patients. So to talk you through what Infinity Health does, it gives me great pleasure to introduce you to the CEO, Elliot Engers.
Hello, my name's Elliot Engers. I'm CEO and co-founder at Infinity Health. Healthcare is in crisis. Even before the pandemic, health systems were facing the challenge of an aging population with increasing complexity. And pressures were steadily growing to provide higher quality and more cost-effective care. But costs have continued to rise unsustainably. The annual NHS budget has grown by almost £50 billion in the last 10 years. And more than 100,000 NHS staff are needed today, and this is expected to grow by more than 1 million over the next 10 years. We simply don't have the candidates or the resources to train and support the staff we would need to meet the growing demands on healthcare. And even if we did, we don't have the time, because the pandemic has significantly amplified and accelerated all of these issues. With a depleted and burnt out workforce now facing an unprecedented and growing backlog of more than 6 million patients waiting for care. It's well known that healthcare has been slow to adopt new ways of working in the past. This has resulted in many critical processes still relying on outdated technologies and inconsistent approaches. This is frustrating, it's inefficient, and quite frankly unsafe. The opportunity for digital transformation in healthcare has never been more apparent. Infinity is a workflow and task management platform built for the modern digital health ecosystem. We integrate and extend existing health information systems like electronic health records, data analytics, workforce platforms, patient apps, and remote monitoring solutions. Infinity provides a task management layer that dramatically improves safety and productivity. This is a task. It describes what needs to be done, who it needs to be done for, when it is due, how it's categorized, which teams or individuals it's assigned to, and the status, be it pending, accepted, started, completed, or cancelled. Our mission is to ensure that every frontline healthcare professional has access to an up-to-date list of their tasks at all times. We believe patients would be safer, staff would be happier, and everyone would have more time. Using Infinity, staff can easily create tasks for their patients and assign them to individuals and teams. Team members then receive notifications and reminders ensuring that the right person is able to do the right thing at the right time. Infinity also provides a seamless way to access critical information, take action, and update colleagues at the point of care. And high-volume mission-critical processes can also be streamlined using automations. This provides consistency and gives considerable time back to staff so that they can spend more time with their patients. And the data that Infinity generates is used by clinical and operational teams to monitor performance and identify issues in real time. We were founded on the simple principle of connecting frontline healthcare workers so that they could collaborate more effectively with one another. Our journey began with an award from Innovate UK to develop a proof of concept, which soon led to our first NHS pilot, demonstrating a saving of more than 10,000 hours a year in a single emergency department. This won us our first HSJ award and our first NHS contract. We've since been appointed to the NHS Innovation Accelerator and agreed our first strategic partnership. Infinity now has been implemented over 10 times within the NHS and used by more than 40,000 frontline staff to coordinate their activity in real time. Our current focus is on the highest priority in healthcare, reducing the pressures on hospitals, and we do this in 3 key ways. Care coordination improves handover and optimises activity when patients are admitted to hospital. Virtual wards allows healthcare professionals to support earlier discharge from hospital and monitor patients in their home. And finally, we're working on 2 nationally funded elective recovery programs to address the growing backlog of patients waiting for treatment. The potential use cases for Infinity are endless. In addition to our current focus areas, we can expand use of Infinity across clinical and operational teams working throughout hospitals. We can also begin to address long-standing challenges of coordinating care between care settings. And of course, this is not a UK problem. Health systems around the world are facing very similar challenges, and the global potential for Infinity is limitless. Our vision is that the data we collect will provide deep insight into staff activity, allowing us to predict future demand and the resources that would be needed to meet it. I lead a team of clinicians, designers, developers and more that have the experience and understanding to address the most critical challenges in healthcare. If you're interested to learn more or you would like to support us on our journey, please get in touch. Thank you for your time.
Hello, I'm Laura Modiano and I lead business development for healthcare and life science startups in Ethemia. I am more than excited to be introducing RemedyRx, a fantastic health tech startup I have had the privilege to work with as they develop a solution to address patient centricity in chronic care conditions, revolutionizing the patient experience by giving them back control of their journey and care in an easy and humanized way. They help patients keep track of their symptoms, translating them from clinical terms to user-friendly language and giving them the tools to self-manage based on evidence and crowdsourced information. Founded by clinicians, health tech serial entrepreneurs, and successful biotech founders who have come together because they understand how the system works, what patients' experience looks like today and where the gaps are, what it takes to sell and succeed in this industry, as well as what pharma companies are looking for in the clinical trials of the future. It means they have a solution and business model we are excited about seeing spreading across the NHS and used to inform drug development. Please welcome them with me and hear from the amazing team on what they have to present.
We are RemedyRx, and we are here to put your health in your hands. I'm Emma Tinsley. I'm the CEO and co-founder of RemedyRx. I'm also a chronic disease patient and have lived with multiple inflammatory conditions for the last 20 years. We believe that the future of healthcare puts patients at the centre of the ecosystem. The Remedy platform is the missing link that restores patients to their rightful place at the heart of things. Chronic disease is a huge and growing problem. 51% of the population suffer from a chronic disease in their lifetime, and 1 in 3 adults will suffer from multiple chronic conditions. These conditions are long-lasting and materially impact patients' day-to-day lives. Our lifespans are getting longer, but we are living with more long-term illness. Importantly, this burden is not shared equally, with patients in the most affluent areas enjoying 19 more years in good health than patients in the poorest areas. The economic burden is also great, with direct costs of over $5 billion per year to the NHS, with further costs to the economy more broadly of over $30 billion per year through lost productivity. The impact from patients from chronic disease is substantial. 95% of the patient experience happens outside the healthcare system. Chronic diseases fluctuate throughout the patient's lives with the variable symptoms, which can be hard to understand, track, and manage. Appointments with doctors are far apart, with check-ins every 18 months or so, and communicating and talking about chronic disease to friends, family, and colleagues can be difficult. Facing up to a long-term disease that impacts the quality of your life on a day-to-day basis can trigger or cause mental health problems such as anxiety or depression. This combination means that living with chronic disease is a long and lonely journey for patients. The Remedy platform is designed to support patients and simplify living with chronic conditions. Our tools anchor around solving 2 key problems for patients. Firstly, understanding their conditions. The Remedy platform enables access to advice on how best to live with your condition, combining input from experts, other patients, and your own personalised progress reports. This includes options for your care now and in the future. Secondly, facilitating communication with others, whether that's providing reports for doctors, helping or being helped by other patients, and giving patients a tool to communicate more easily with their support networks via their personalised dashboard. For too long, people making the medicines have failed to listen to those taking the medicines. By truly putting patients first and building tools to support them, we form a direct link with patients that lasts over time. This is a shift towards whole-person healthcare where we don't treat disease in isolation. The Remedy platform scales to capture multiple conditions at once, making it easier for patients and giving never-before-seen insight into living with multiple conditions. Our platform shares chronic disease data for all stakeholders, from and between patients to the healthcare system, and with commercial partners such as biopharma and governments to improve research, care, and the medicines we produce. What they share is in the hands of the patient, with privacy by design at the heart of the Remedy platform. We promise never to share identifiable data with third parties for any purpose other than research and clinical care as chosen by the patients. We are certified Cyber Essentials Plus and working towards ISO 27001 accreditation. The power of sharing this information allows everyone to benefit from an improved understanding of chronic conditions and keeps the platform free for patients. We can transform how healthcare looks today, both from the power of direct access for patients to services and clinical trials to using data to support decision-making in healthcare and research. Looking at clinical trials as an example, currently, trials are designed without any interaction with patients and criteria are preset for their inclusion. There is then a process to find and recruit patients, with the average rate in the UK of 1 patient per trial per month. Many patients are turned away because they don't fit the criteria of the trial. Compare this to a clinical trial recruited via the Remedy platform. The patient is using Remedy already to manage their health condition and has opted to share their data for research and clinical trials. Using the patient's data, the trial is designed to be representative of them. The patients are contacted directly through the Remedy platform and told a trial is available for them because it's been designed for them. The screening process is much faster, with trial groups effectively pre-recruited. Currently, access to research is severely skewed by factors such as geography, gender, ethnicity, and socioeconomic status. The Remedy platform begins to democratise this and broadens the number of patients able to participate in and contribute to research. The potential impact of this on the speed and cost at which we can bring new medicines to market is huge. About 25% of the drug development cycle, or 3 or 4 years, is spent for waiting patients to be recruited for trials. Our team is experienced in patient centricity, clinical trial design, and technology for communities, bringing together a diverse group of skills and experience to develop the platform. We also benefit from close links to our sister company, Weatherden, a clinical development consultancy that works with biopharma and focuses on clinical trial design and translational medicine. We're excited to be conducting our pilot studies in the UK and Sweden, and we'd love to hear from patients and healthcare providers interested in joining our mission to transform the treatment of chronic disease. We will also be seeking investors in our seed round soon, so please do get in touch with either of those of interest or with any other questions. You can find out more and sign up at our website, www.RemedyRx.co.uk. I wanted to end on our promise to patients, to understand your disease and empower you to drive improvements in your care and medicines. Thank you very much.
Hello, everyone. It's my pleasure to introduce See the Signs, an early cancer detection solution. I'm Hector Rodriguez, an Executive Security Advisor for AWS Healthcare and Life Sciences. I'm really impressed with See the Signs and their focus on being a data-driven solution that brings together the information, tools, and recommendations to help patients and clinicians with early detection, diagnosis, and treatment. This is critical because when diagnosed early, over 80% of patients survive to 10 years. But when diagnosed late, less than 20% survive to 5 years. This is a solvable problem. With that, please welcome Dr. B. Bakshi, CEO and co-founder of See the Signs.
Hi, my name is Dr. B. Bakshi. I'm a GP by background, co-founder and CEO of See the Signs. Cancer is the second leading cause of death globally, with 1 in 2 people being diagnosed with cancer. Currently, half of all patients are diagnosed in the late stages of the disease, and because of that, less than 20% will survive to 5 years. Yet if diagnosed earlier, over 80% of patients would survive 10 years or more from their cancer. It is also at least 50% cheaper to treat an earlier stage cancer compared to a late stage cancer. On top of this, the pandemic has had a catastrophic impact to early stage cancer detection, with an 85% drop in cancer referrals and over 60,000 cancer patients missing. Yet early detection is exceptionally challenging. There are over 200 different types of cancers, each with their own signs, symptoms, and risk factors, the earliest of which are vague and non-specific. At the first appointment, to identify a patient at risk is almost a needle in a haystack, as cancer can present at any age, with any patient, anywhere in the body. See the Signs is the solution to this. It's an evidence-driven system that essentially is accelerating early and faster cancer detection using prediction. The system enables healthcare professionals within the NHS to identify patients at risk of cancer at the first appointment and fast-track them to the most appropriate setting, ensuring that patients have the fastest and the earliest time to diagnosis and time to treatment. You can see here that See the Signs enables cancer risk assessment within less than 30 seconds, enabling GPs and healthcare professionals to make quick decisions which are evidence-driven, but taking a symptom-first approach with the ability to search for any sign, symptom, or risk factor against cancer. The patient is also always kept in the loop with the ability to text resources in multiple languages via SMS, email, or print. We track all patients through our system to make sure that we are following patients up to prove that we are diagnosing quicker and earlier. With the real-time cancer dashboard using both passive and active risk assessments, we're able to populate this dashboard to continue to track patients where they are in their cancer journey until a cancer diagnosis has been made. Alongside this, we are building one of the world's largest cancer presentation models, as we're able to close the loop from cancer presentation, route to diagnosis, and cancer outcome. Our real-time dashboard provides the first ever within the NHS where cancer data can be seen and all activity across primary care. This dashboard takes a data-driven approach to quality improvement and to earlier cancer diagnosis. And what is the impact we are seeing? So already through our cancer risk assessment, we've been able to prevent almost 5,500 cancer referrals where patients actually have been safely identified as not being at risk of cancer. This is instrumental to the elective recovery and supporting the efficiency as the NHS makes the recovery. We've also been able to demonstrate improvements in cancer detection rates using matched control sites and comparing with England average performance. You can see that See the Signs trial sites have outperformed these areas, demonstrating improvements on cancer detection rates. Most notably, on the right-hand side, you'll see that improvements in detection rates isn't at the expense of increasing the number of people referred into the system. Through our intelligent system and algorithm, we're referring the right people down the right pathways to improve earlier cancer detection. We also saw a huge impact during the pandemic, and comparing practices using See the Signs and not using See the Signs, despite those not using See the Signs having a higher cancer detection rate pre-pandemic, we saw a greater drop post-pandemic, unlike the areas using See the Signs, where their cancer detection rate increased during the pandemic with the aid of See the Signs. We also saw a massive impact on the waiting time and treatment time standards, where you can see that See the Signs is getting the patient faster through the system and faster to a treatment pathway compared to the NHS performance nationally. This protective effect will be a huge asset to the elective recovery plans. So where are we now? We're working with a multitude of stakeholders across the NHS, both in England and in Wales, to support earlier and faster cancer detection, and we're growing rapidly. To find out more, please get in touch. My email address is bbakshi@seethesigns.net. Many thanks.
Hello, my name's Dr. Andrew Jones and I'm the Head of Clinical Innovation at AWS. I had the privilege of mentoring DDM Health and it is my absolute privilege to be able to introduce them to you today. They're producing a range of apps and services to help people self-manage at home. Important clinical conditions such as obesity and hypertension, polycystic ovary disease and others. This is really important in the post-pandemic era to help populations manage their own conditions to a larger extent. It's an amazing set of applications and I really hope that you enjoy their pitch. So over to you, Arjun and team.
Good morning. My name is Arjun Panesar and I am the founding CEO at DDM Health. We're an award-winning provider of precision digital therapeutics that combine behavioral science with deep tech AI to improve patient health outcomes, improve health equity, and unlock clinical efficiencies. I don't need to tell you about the spiraling costs of healthcare. Non-communicable diseases, or NCDs, like obesity and type 2 diabetes cause almost 9 in 10 deaths. Together, they pose $1 trillion burden to healthcare systems annually. And unfortunately, your income, ethnicity, and neighborhood make the biggest difference in you accessing and engaging with health services. Our mission is to empower people to lead healthier, longer lives and unlock clinical efficiencies without leaving anyone behind. We do this with our award-winning, clinically demonstrated digital therapeutics. Grow Health, our flagship intervention, provides personalized health self-management, home monitoring, and long-term behavioral change support. It's accessible across multiple platforms including the web, mobile, and smart speakers like Amazon Alexa, and it's personalized to a user's starting health and uses AI to better understand users' behaviors, preferences, and habits. And it's demonstrated in a number of cardiometabolic health pathways. The platform is used in the NHS and with insurance and enterprise partners, and it's the highest ever Orca-rated digital health app, scoring 96%. Specifically within healthcare, Grow Health is used as a patient-centered virtual recovery and patient service pathway, providing diagnostic support between patients and clinical teams, management of chronic conditions, and to reduce health inequalities in health services. We provide a full end-to-end ecosystem. Personalized programs are tailored to users' disease profile, ethnicity, age, gender, and location, and focus on the 4 therapy areas of nutrition, sleep, activity, and mental well-being. Integrated health tracking provides the ability to sync to popular wearables and track health biomarkers. We use sophisticated health quantification tools, which provide insights to empower user and clinical decisions. And remote monitoring is supported through our clinical dashboard, which has been co-designed with physicians to provide real-time analytics, support clinical decision-making, risk stratification, and triaging into telehealth. All of this is provided through a completely customizable self-serve CMS that can be tailored to the provider's exact requirements. Importantly, the Grow Health platform democratizes access to health and care services. The platform is available in 11 native languages, localized and adherent to the norms and expectations of over 20 cultures and faiths. Our platform is demonstrated in a number of peer-reviewed published studies to support patients and clinicians, and we segment our outcomes into people receiving care and care delivery. For patients, our platform supports weight loss, improvements in glycemic control, reductions in medication usage, and improvements in mental health markers, specifically stress, anxiety, and depression. And it also is demonstrated to reverse type 2 diabetes. Importantly, our services democratize access. In terms of care delivery, we have been shown to have market-leading acceptability from ethnic minority communities compared to their white British counterparts, and have been shown to provide equivalent outcomes to traditional face-to-face care, saving £117 per patient per year in reduced diabetes medication costs. All of these outcomes are delivered through a remote digital platform with a low marginal cost to scale. And this is without taking into account any other data, highlighting how precision digital therapeutics can be used to deliver value-based care at scale. Collaboration is vital to achieve large-scale change, and there is a huge opportunity to improve population health through widespread adoption of our award-winning innovation. We're working with AWS to consolidate our architecture and improve scalability, improve latency, particularly on our Alexa skill, and use some of the more sophisticated features of AWS, such as analytics and Lex, to support the expansion of our digital care ecosystem. Ultimately, by personalizing care to people's health, lifestyle, and expectations, we have been able to achieve significant growth, working with over 25 NHS primary and secondary care partners, insurance companies, reinsurance companies, and enterprise organizations. And we would love to hear from partners that wish to improve the mental health and physical well-being of the populations they care for. Thank you.
Hi, my name is Matthew Howard. I lead data science for AWS Healthcare. I am very excited and privileged to have been working with Abtrace during the Healthcare Accelerator. Abtrace are helping to drive a fundamental and much needed transformation using healthcare information in primary care settings at patient and population scale for continuous and predictive monitoring to help patients stay healthy and also to help them to avoid preventable disease. In an NHS under increasing pressure, not least in primary care, what Abtrace have developed is exactly what's needed. It's about keeping people well rather than waiting for them to get sick. They've got an amazing team, they already have customers and technology in the market, and I think you're going to be impressed. I'm delighted to introduce them to you now.
Hello, my name is Umar Ahmed. I'm the CEO of Abtrace, and I'm also a NHS doctor. And I think the NHS is an incredible healthcare system, but like many across the world, we end up sometimes providing sick care rather than healthcare. So we wait until the patient deteriorates and ends up in hospital, or goes to their GP and asks for help, and we react to their illness rather than take a more proactive approach. I think we'd all agree that it is much better to prevent disease by finding people at risk, giving them evidence-based interventions to make sure that we delay or stop the onset of their disease. And if they're going to get a disease, like cancer for example, then we can detect it as early as possible and treat it effectively. And where patients are going to develop diseases like hypertension or diabetes, then we make sure that we find that disease and monitor it consistently over the years to make sure that any deterioration is picked up and treated before it has consequences. So at Abtrace, we're building a healthcare system that is proactive, that is predictive, that is preventative. But how can you ask clinicians, despite all the resource constraints, the COVID pressures, the staff shortages, to do more with less, to provide even better care for even more people? Well, we think that electronic health records allow the potential to really industrialize medicine, to take medicine as it currently is, an artisanal industry where doctors are highly trained, spend years learning their trade from their colleagues, and then are expected to practice where they know everything, where they can do the right thing for every patient all the time. A system which is inefficient and costly, inconvenient to patients, inconsistent in quality, and actually quite frustrating for clinicians. And we'd like to move to a system where some of these decisions are automated or augmented and improved so that clinicians can make better decisions, but they also have more time to spend with those patients that really need it. And in the end, we remove that duplication, we remove that inefficiency, and we reduce costs. So we spent the last 3 years building a stack that integrates into electronic health records. We now cover 96% of the UK population with our integrations. And it pulls from them every day all the relevant data, the relevant insight, and it makes sense of that complex medical coding. And then it processes it through some algorithms, whether they be NHS guidelines or machine learning, and then it finally delivers them as a software product on the system of a GP or any other healthcare professional, and it allows them to consistently make a better decision at the point of care. So our first product is called Proactive Monitoring, and it essentially takes all the diseases that you have, all the drugs that you take, all the tests that you've done, and it summarizes all of a patient's current monitoring needs, both for an individual patient and for the population as a whole. So it allows practices to deliver better care, but also reduce their costs. And it's been incredibly popular. So over the last 6 months, we've gone from 15,000 patients to over 1 million patients, from 2 sites to 85 sites, covering more than 60,000 appointments per week. And we work with medical data. So we need to make sure that we're both secure with ISO certifications, various NHS compliance requirements, and penetration tests, data security, and so on. And at the same time, the software needs to be clinically safe. So we have a UKCA mark medical designation, a CE mark, and we also operate under ISO 13485 compliance systems. Ultimately, we process data on behalf of practices for the purpose of looking after their patients. We never transfer data to anybody else, and we were very careful. We work with a number of EHRs, AHSNs, hospitals, GP practices, accelerators, funders, charities across the UK and the world. So with the support of all of these partners, we've raised £4.1 million to date and are about to open another round. So if you'd like to get in touch, please contact me on omar@abtrace.co, and I'd love to hear from all of you. Thank you very much for listening.
Hi, I'm Des Shanahan, an account manager here in the AWS Healthcare team in the UK. I've had the pleasure of supporting Birdie over the last 4 weeks of the Healthcare Accelerator. They have a fantastic team working across engineering, solution development, and data science, all working together to deliver Birdie's vision of a society where we can age with confidence, living healthier, happier lives for longer at home. Birdie solutions leverage cutting-edge technologies, including machine learning, all designed to enable the care community to deliver better preventative care at home. They work with about 700 care agencies, delivering in excess of 500,000 care visits per week. And to tell us a bit more about the work that they've been doing, I'd like to introduce Samuel Rose, CTO from Birdie.
Thanks, Des. Hi, everybody. Today, there are 700 million people aged 60 or more. There will be 2.5 billion by the end of the century. That's a shift from 9 to 23% of the entire population. While we all live longer, our healthy lifespan roughly remains the same. It is the time spent sick and often dependent on others that expands. Now, as a consequence, in the UK alone, up to 60% of public health cost goes to this population. Falls alone cost the NHS 2 billion every year. Now, unfortunately, on top of that, social care is already overstretched. We hear that on a very regular basis. Aged UK estimates that up to 1.4 million older people do not have access to the care they need. Now, the good news is it doesn't have to be. Geriatricians know that if we were to consider care holistically rather than location or condition specific, as most of the healthcare seems to be done today, we can drive billions of savings and significantly increase outcomes for older adults. Now, our ambition is to use technology to really realize this. And from recent adult social care policy paper to a study last year that finally demonstrated care at home as a cheaper alternative to residential care, the momentum is here, and this is what we wanted to do. Now, this is why 4 years ago, we've started to build a full-stack technology platform to become home care providers as technology partner. So we enable them to deliver better care for a growing amount of older adults while improving their margins up to 15% on average. We support 650 social care agencies, helping them to deliver 500,000 visits every single week. Now, for this program, we actually decided to focus on laying down the foundations for our digital care assistant. It provides caregivers and care managers some insights to deliver better and more personalized care. To give you some context, as you can see here, caregivers carry out visits every day using the Birdie application. They captured structured observations and write notes. In these 4 weeks, we've decided to achieve 2 specific things. First, generating relevant action recommendations, combining insights from observations and all of the existing health and well-being context of an older adult. But second, increasing the quality of these recommendations through increasing the number of structural observations by extracting them from free text. Quite ambitious for 4 weeks, but this is actually what we did. We did deliver a very bare minimum and valuable product for falls prevention. Well, we didn't settle yet on the best way to commercialize this assistance. Discussing with our mentors from PUBLIC and AWS, we put together our first rules for falls-related interventions recommendation. In this example, on the left, recommendation for a care manager to carry out a in-depth everyday activity assessments because of a vision loss medical history and recent observations of weakness and tiredness. On top of that, AWS NLP experts helped us to increase the number of structured observations on average by 20% per care recipient, extracting these from text. We don't have yet a number to share, but we really believe that this will increase the accuracy and the value of these recommendations. Now, lastly, we've validated with real experts in the field, our customers, the value and the best way to provide these insights to them within the Birdie product. Now, going forward, as I mentioned, we are going to actively invest in this facet of the product this year. With a really large growing network of care agencies across the UK, we strongly believe that this is the right moment to double down in first showcasing the benefits of the investments we've made early on in the interoperable and structured platform that we've built. And second, that the technology can be a significant enabler for better care. On that point, we'd love to hear from you. We strongly believe that such initiatives can reduce the cost of care while increasing health outcomes, and we'd love to find pilot opportunities. In particular, we'd love to prove shorter or prevented hospital stays. We believe there is huge potential there. To wrap up, just wanted to say thank you to the PUBLIC and AWS teams, Des and Steven in particular, really supported us throughout this program, and our Birdie team that worked on this as the significant stepping stones for our ability to improve the lives of millions of other adults. So thank you.
Hi, my name is Steve Johnson and I'm a Senior Solutions Architect at AWS focused on healthcare. It has been my pleasure to be a technical mentor to Dr. Julian throughout the Healthcare Accelerator. Dr. Julian is a mental health and well-being application which enables easier access to counselling. It helps individuals get access to therapists and psychologists when they need it, online, via video and instantaneous text. I've thoroughly enjoyed working with the team throughout the Healthcare Accelerator, including discussing approaches for scaling their services on AWS so they can achieve their goal of providing better access to mental health support for all.
My name's Dr. Julian Nesbitt, and I'm an active NHS GP who has seen firsthand the issues this country is facing in terms of its mental health provision, and I wanted to create a solution to meet them. I'm going to go through the challenge, what our platform is and where it's going, and summarise. Well, the challenge. We all know the massive problem this country and the world is facing in terms of mental health provision. There is just not enough supply of therapists for the huge demand that is ever increasing. There are also huge barriers to accessing mental health services and support. Over 1.6 million patients are on an active NHS waiting list with an already 3 to 6 months wait. My belief is that with technology, we can help drive efficiency and augment the therapist to meet this challenge in a new way of working. Well, what is the platform? Well, we created the Dr. Julian platform to try and improve access to mental health services. Over the last 6 years, we have built this platform in-house, working alongside the NHS. It provides a full end-to-end therapy provision solution. The platform allows the creation of more therapy hours through greater efficiency and a reduced admin burden. It can also allow augmentation of the therapist with self-help resources and homework tools. It connects patients to vetted therapists via secure video, audio, and instant message. We're currently supporting over 25 IAP services nationally to help with their provision using our own therapist network and have completed over 50,000 sessions. We've also now launched other services such as Children's, Ministry of Defence, University and corporate services and are expanding rapidly. We empower patients and integrate a patient-facing side into our electronic health record. This slide shows the unique patient dashboard that's tailored to individuals where they can complete assessments pre-appointment, get matched with the most appropriate therapist for them, as well as having a choice of therapist and being able to book their own appointments and even reschedule them directly with the therapist, as well as then having access to all of their notes and letters. On the patient dashboard, we've also now launched a unique resource library that is tailored to the individual patients based on their presented complaint and what has been assigned to them by their therapist. This way, patients have dedicated, vetted resources tailored for them on their profile, which can help them before, during, and after therapy. As well as a patient side, it has an extensive range of back-end functionality for admins and therapists, including a large data analytics functionality and reporting to comply with the NHS IAP dataset, the ability to create customized white-labeled portals for every organisation we work with, and the ability to customize therapist note templates, letters, and registration forms, as well as email reminders with triggers. The platform has continually evolved based on patients, therapists, and public engagement feedback, which has all been very positive. Using the platform can help the environment with no need to travel, and it also improves health inequalities with patients being able to see a therapist of their own culture and language. An independent evaluation conducted by the KSS AHSN of the use of our platform with our own therapists and IAP services showed that the platform delivers improved recovery, halved the did not attend rates, doubled engagement, and reduced the dropout rates. It has also been shown to have favourable health economic outcomes, with NHS getting back £1.33 for every £1 spent on direct costs, and actually 2.5 back if you include indirect costs. We have an experienced, fast-growing team of over 30 people, which is growing rapidly. So where are we going? Well, we continue to expand our service provision in both public and private sectors, as well as providing patients with free access to tailored self-help resources and tools. And with the help of AWS, we will grow our selling the platform as a service SaaS model to both NHS IAP services and the private sector, using our system with their staff to help other therapy service providers and give them a platform structure that improves efficiency and better care for all parties involved. In fact, we have actually already started this with NHS Practitioner Health, who are using our platform technology as a SaaS model. So in conclusion, Dr. Julian's proprietary technology platform and growing therapist network can maximise efficiency and effectiveness of the therapeutic workforce, augment the therapist with resources and tools via the platform, reduce admin burden and provide health economic savings, and deliver high quality therapy to many more people faster and easier. Thank you.
Hi there, my name is Abhijit Kulkarni. I'm a sales manager in startups team here at AWS UK, and I have the pleasure of introducing you to Wysa. I had the pleasure of being their lead mentor over the last few weeks, and I'm really impressed by the work that they are doing. Wysa is an AI chatbot designed to make people mentally more resilient. People who are experiencing low mood, stress, anxiety, or want to improve emotional resilience can talk to Wysa chatbot. Now, you may wonder whether Wysa is an AI or a human, and the answer is both. Wysa's advanced machine learning technology powers its chatbot, and they also offer professional support via trained mental health professionals. I was particularly impressed by the use of technology, use of advanced machine learning to offer easy access 24/7 to a very high quality mental health support. I really enjoyed working with Wysa, and I will let them tell you more. Thank you.
Hello there, my name is Ross O'Brien and I'm the Managing Director for Wysa, the world's most advanced conversational AI for mental health. And our vision is to get mental health into the hands of everyone. We were the top rated app on Google Play across all classes, and we were also the top app on the Orca library for health and care. And we're very proud to be part of the Healthcare Accelerator at AWS. So what does Wysa do that's different from other mental health apps in the space? Well, essentially, as an AI-backed platform, we're able to scale into the area of primary care mental health services. So whereas most apps will look at wellness in terms of mindfulness or meditation, we're able to safely move into the space of actually treating and supporting patients directly, both inside the NHS and wider globally for EAP or PMI. We're able to offer support for people that are lonely, upset, anxious, burnt out, low mood, and integrate into local healthcare care pathways to deliver those services. Wysa's history is we've got over 4 million downloads globally. We're in 65 countries, and we know of 180 suicides that are self-reported that we've helped prevent. In terms of what we offer, we're an app-based platform and also a web-based platform. We offer a range of different evidence-based techniques for mental health, and then specific guided self-help packages or programs to take people through therapy online. We're also able to offer therapists into the space. So we've got a range of solutions. First and foremost is our AI chatbot. We find that we get great responses from patients for this. When they want help, they can get help. So at the time of reaching out, they can download the app and instantly get access to the AI chatbot at any time of day. And this is kind of a reflective friend, or in a way it can be like talking to your own personal therapist. We also have a range of self-help modules that are also available 24/7, and we've got over 150 of those. Then we've got guided self-help. So this is where we integrate into the therapeutic offer of the local care system. So for example, in the NHS, we would integrate into IAPT or CAM services. Outside of the NHS, we can integrate with EAP or private medical insurance offers. And we've also got our range of therapists online or coaches online as well. So if people prefer to talk to a human, they can book in that time and have a conversation with a therapist or coach. Then in order for the therapist or coach to see what is happening with the patients, they use something called a therapist companion, and this links with all of the guided self-help modules and shows the activity of the patient. It also allows us to prescribe to patient-specific modules. And one of the things we've been working on recently is becoming the front door for all mental health services in the NHS. And we've developed an e-triage that's integrated with the largest electronic health record in the UK, and we've got the ability to do that globally as well. So if you were to look at our offer in one slide, this would be it. We've got a digital front door where we can onboard patients. We can make a massive difference in their lives by giving them real-time support directly at the point of onboarding. And this is, we hear feedback in terms of wait list. This is exactly what patients want. And we're really proud to be able to offer it to patients for the first time. We've also got the offer of digitally enabled therapy. So as I said, when people move into therapy, they can get access to all of our therapy programs, or they can get a psychotherapist online as well. These are the organisations that we've worked with and the certifications that we've got. Importantly, in the UK, we've got the DTAC, but wider in Europe and in the States and globally, we've got HIPAA standards, DCB, ISO standards as well. And we've worked with a range of really world-class universities on this. In terms of our notable partners, here you can see some of the partners that we work with globally in the UK, US, Europe, Middle East and Asia. And then finally, our team. We're a team that's scattered across the globe, predominantly in India, the UK and the US. Thanks for allowing me the time to talk to you today.
Hi, my name is Amrita Sarkar and I'm a Principal Business Development Manager with the AWS Healthcare and Life Sciences Startups team. It is my great pleasure to introduce to you today Sapien Health, whom I've had the pleasure of mentoring from a business point of view over the last few weeks. Sapien Health is a digital clinic for people who are preparing for elective surgery, and it helps them make sustainable lifestyle changes to have better surgical outcomes. What I've been most impressed with when working with the Sapien Health team is just how great they are with respect to strategic execution and planning. They have been great with regards to planning their fundraising round, planning market entry into the United States, and of course they've achieved great traction in the UK where they're currently based. So I look forward to having you discover Sapien's very cool product, and hopefully you'll be as impressed as I've been. Thank you.
Hi, I'm Luke Eastwood. I'm one of the co-founders of Sapien Health, which is creating a digital clinic for surgery. Let's start with the problem and the existing model of care. So at the minute, unfortunately, there's a widespread misconception that surgery starts on the day of the operation. In reality, we know that everything you do both before and after the surgery plays a critical role in its success. So at the minute, people are turning up ill-prepared. They're mentally and physically not quite where they should be, and this leads to all sorts of problems such as cancellations, longer hospital stays, post-op complications, and longer recovery times. Of course, there are huge financial implications to this. So last year, the NHS spent £3 billion on cancellations. There's an additional cost of £710 per patient due to post-op complications. And at the minute, 80% of care teams report being at high or very high risk of burnout. COVID has exacerbated these problems. So there's over 6 million people on the waiting list at the minute. This number is expected to increase. And the real people, the patients that have had their surgeries delayed, unfortunately, in many instances, their underlying condition deteriorates, they get worse, they end up costing the healthcare system a lot more. So for sure, more needs to be done to help these people. So how does Sapien propose to help? Well, we're with patients every step of the way, from the decision to operate right through to recovery, and our service is built on 4 key pillars. So expert human health coaching, the ability to track health metrics with pre and post surgery, peer support from like-minded individuals who are undergoing something similar themselves, and tailored content. And this includes lessons, workouts, meal plans, and lots of surgery-specific content as well. If you're not familiar with the role of the health coach, they're critical in helping people take control of their own health. They'll use lots of techniques like shared decision-making and positive psychology, all with a view to driving positive behavior change of the modifiable risk factors affecting the success of the surgery. If we take a look at one of our deployments with NHS South Tees, this was featured in the NHS X digital playbook for perioperative care. And here we were able to effect a 12-point increase in PAM, patient activation measure. We were able to reduce the length of stay by 1 full day. The self-rated behavior metrics shot way up. And YHEC, the York Health Economics Consortium, who analysed our work, have predicted we're saving £564 per patient which represents a significant ROI. We are validating cost savings at the minute via a multi-site randomized control trial. Of course, the user metrics are equally encouraging. We have an 86% completion rate, a net promoter score of 90, and 97% of participants have said they'd be somewhat or very disappointed to lose access to Sapien. Of course, we have all the regulatory accreditations necessary to work with the NHS, from ISO 27001 to DTAC, the Digital Technology Assessment Criteria. I'm going to finish with a quick video showing you the app, but if you'd like any help trying to get on top of your elective backlog, please do not hesitate to get in touch. Thanks for listening.
Sapien Health is a surgery support clinic on your phone, helping you with almost everything you need to have a successful operation. Our digital program will help you with your physical and mental well-being to reduce the time you spend in hospital and get you back to living your best life sooner. Sapien is available through a growing network of NHS hospitals and private healthcare providers. As everyone's challenges and goals are unique to them, we tailor the program throughout to meet their needs. Patients can easily track their habits and biometrics so they can get real-time feedback and insights. We provide a complete toolkit of resources covering health and wellness to surgery-specific materials. Our expert health coaches meet patients where they are, around the clock with chat and video calls to support and advise them along their journey. The result? Higher quality care, lower healthcare spend, and happy patients. Sapien Health is building the surgical care system of the future.
Hello, I'm Gemma McCarthy, a healthcare account manager focused on NHS trusts at Amazon Web Services. During the accelerator, I've had the pleasure to work with Dignio, a really impressive startup from Norway who are looking to expand across the UK and US. The Dignio integrated healthcare platform focuses on improving people's lives by allowing monitoring to happen throughout recovery outside of the hospital walls. It provides a holistic, integrated approach to reduce hospital admissions. What has impressed me about working with Dignio the past couple of weeks is their underlying philosophy when it comes to the tech. They strive to train both the patient and the clinician only once. The technology doesn't need to be complicated and complex when monitoring multiple conditions. Now, I'd like to introduce you to the Managing Director of Dignio and their demo. Enjoy.
I'm Eva Trhanovic. I'm the Dignio UK Managing Director. We help people get better and stay well in their own homes and out of hospital. We are a multi-award winning company in recognition of the outcomes we've achieved for the NHS and their patients. We are a market leader in Norway. We also operate in the UK and US. One of our UK customers using our solution since 2019 is now running more than 10 virtual wards with one and the same solution, preventing more than half of the expected hospital admissions. Our youngest user is 3 years old and the oldest one, 103. It's the thinking and design underpinning Dignio Tech that create one solution for many problems, which evolves with changing individual and system needs. Staff get trained once, patients get trained once, and there's no need for a multitude of apps for people with complex needs. Dignio solution enables staff to work efficiently and at the top of their license. The traditional model of care delivery is about fixing something when it goes wrong, and sometimes catching problems too late when they are more expensive to treat. In a digital model of delivery with Dignio Connected Care, the focus becomes proactive care, offering remote support, early deterioration of detection, and timely treatment. We work with clients and partners across multiple levels of care, helping patients with a diverse range of diseases and needs to stay safe, well, and out of hospital. Our solution is also used in a portfolio of research projects ranging from neurology to maternal health. We strive for high standards in how our solution is manufactured, updated, and deployed. Our standards are an assurance of the service quality and data security we provide. I will close this presentation with a short video of what our connected care concept is all about, and please do get in touch to find out more.
As our reliance on healthcare systems increases, so should the importance of moving towards proactive and personalised healthcare, giving people optimal care in their own home. The Dignio integrated care platform is designed to improve people's lives, helping them stay out of hospital and making it easier for their clinical conditions to be monitored wherever they live. It provides a holistic, integrated approach for people with multiple conditions, like John. He's just been diagnosed with diabetes. He's also had COPD for several years. He's at risk of becoming unwell, so his doctor recommends the Dignio solution. John starts using the My Dignio app to self-manage and monitor his COPD and diabetes. He later develops heart disease, and all of these conditions affect his mental health. With the Dignio solution, John doesn't have to grapple with lots of different apps to help him. Clinicians can simply add new pathways so that Dignio travels with John throughout his healthcare journey. The My Dignio app automatically sends John's vital signs direct to his clinical team via the Dignio Prevent platform, where it's risk stratified, helping to make sure he's okay and identifying when he needs extra help. John's carers use the Dignio Care app to record their observations when they visit him. Through secure video and chat, John can stay in touch with his multidisciplinary care team, making him feel safe. The Dignio integrated care platform is already being used by local authorities, acute hospitals, mental health and out-of-hospital providers and others. It's a solution that's helping to shape and improve the experience of people receiving health and social care provision. Integrated, personalised care is the future, and Dignio brings this future to all of us today.
Thank you very much for your attention, and please do get in touch if you would like to know more about our solution or indeed see a demo of it. Thank you.
Hello, I'm Laura Modiano, and I lead business development for healthcare and life science startups here at AWS. I could not be more excited to have worked with Ethemia, a startup that takes the subjective out of the diagnostic process and puts technology, AI, and research in the hands of clinicians to diagnose and monitor patients' mental health with an end-to-end solution that plays a class above any other player in the market. They have entered the space by targeting clinicians, but their applications can be expanded to HR teams, to the hiring and training process, to teachers and the army. With their technology-first, quick and easy solution, they can use basic inputs such as voice and movement to provide accurate assessments of emotions, mental health, and mental and neurological disorders. Their founding team is absolutely incredible. Their CEO, Emilia, is a PhD and postdoc from UCL in linguistics, cognitive neuroscience, and experimental psychology. One of about 10 people in the world to be so highly specialized, with over 10 years of experience using language as a biomarker, while the COO, Stefano, is a theoretical physicist turned quantitative analyst and expert in translating theoretical AI to real-world applications. I am beyond excited to see what the future holds for Ethemia and to see them grow. Please welcome them so we can hear their story.
Hi, I'm Emilia, CEO and co-founder of Ethemia. Depression is a massive, constantly growing economic and societal problem. It affects over 1 in 5 people worldwide. Annually, it costs the global economy over $1 trillion, but clinicians around the world lack the tools to tackle the issue properly. In physical health, clinicians have a wide array of objective tools such as blood tests, thermometers, pulse oximeters to objectively assess physical conditions. In mental health, however, there is nothing this objective. Current depression assessments are subjective, biased, non-continuous, and outdated by almost a century. As a result, the correct diagnosis and treatment are based on trial and error, and it can take over a decade to find them. On top of that, job stress means that clinician numbers are actually dropping, whilst waiting lists grow. We are here to solve all of that, using cutting-edge neuroscience and AI to create the equivalent of a blood test for depression. We use video games based on neuropsychology that analyze facial expressions, speech patterns, and behavior to finally make mental health assessments objective, accurate, and fast. Around this core technology, our end-to-end solution supports clinicians before, during, and after each appointment, saving them time and costs. Here you can see an example of our video games. Instead of answering how sad they feel on a scale of 1 to 4, patients interact with an engaging, friendly interface, whilst clinicians are constantly updated with information. It isn't just patients who love our systems, however, but also clinicians. With a small team and in less than a year, we have already built out one of the best solutions that clinicians have ever seen. Imagine what we can achieve yet. So what do we measure? We use these 3 rich physiological data streams of voice, video, and behavioral data to isolate and quantify all of the core symptoms of depression, including fatigue, mood swings, and attention shifts. Our research has proven that each of these data streams is actually more strongly linked to a different set of symptoms. So if you want to have a good overview of all symptoms, you must combine all of these data streams. But why are symptoms so important? Because it is these symptoms that are driving the treatment decisions and clinician reimbursements, not the actual diagnosis. Others have tried to tackle this issue before, but we're the only ones to use more than just voice and to look beyond simple diagnosis. Combining multiple data streams is absolutely crucial, not only for quantifying symptoms, but also to create an accurate and robust model that distinguishes depression from other disorders, such as autism in children or dementia in the elderly. Our market potential is also massive. We charge on a patient per month basis, starting at £5 and growing over time to £40 per patient per month, with our global TAM at over £19 billion and our UK SAM at £3 billion. Our traction to date is also remarkable. Within less than a year, we have successfully closed paid contracts for over 80,000 active monthly users, with our projected ARR for this year at 3 million, tripling within a year and then more than doubling within another. Within 5 years, we are on track to become a billion-dollar business. On the product side, our virtual clinic platform is live this month with clinicians across the UK and soon across Europe. We have gathered the largest multimodal dataset in existence and trained our models with it. Collectively, in the past 12 months, our stellar science team have published 9 peer-reviewed articles, 2 of which were in Nature. Our hard work is being recognized with press articles worldwide. We were recently named one of the top 100 UK startups and one of the top 20 mental health companies globally. Finally, what really sets us apart and what makes all of this possible is the fact that we are simply hands down the best team to tackle this issue. Our CSO, Dr. Nick Cummins, is the world's leading expert in multisensory signal processing for mood disorders. Our CTO, Dr. Stefano Goria, has over 17 years' experience building the same multimodal machine learning models we are using in Ethemia today. Our COO and CGO together have decades of industry experience in rapidly scaling health tech companies. As for myself, I have a PhD in neuroscience with over 12 years of experience using language as a biomarker for cognitive disorders. There are fewer than 10 people in the world with my niche expertise. Today, we are kicking off our seed round. We are raising £6 million in order to aggressively scale our team and all sales channels, as well as dominate in the US. We already have strong interest from both EU and US investors, and we are looking for a lead investor who understands our vision and shares it with us and can help bring us to the US. We are also, of course, always on the lookout for clinical partnerships, both inside and outside of the NHS and abroad. So if you'd like to try out Ethemia in your clinic, please reach out to us. We are Ethemia and we are making mental health assessment smart. Thank you.